Great. Well, thank you everyone for coming. So again, today's talk is going to be about global surgery 101, hashtag global surgery and the role of social media in global surgery. So I'm going to take you through a bit of why we really have to focus a bit more on social media and what the importance is of social media in advocating for global surgery and spreading awareness about the matter of access to safe, timely, and affordable surgical obstetric and anesthesia care around the world, rather than just our traditional focus on research papers, on policy papers, etc. Today, over 40% of adults, and it's slowly becoming over half of the world's population, have a smartphone. And among those, obviously, 2.62 billion people are using social media around the world. Of these, 2.23 are on Facebook, but also a large majority are on Twitter and LinkedIn, with 330 million people on Twitter, for example. And the real power of social media is not just for us to share what we're doing, but it really allows for real-time dialogue around the world. So I'm sitting here in Washington, and I know some of you are either in India or Australia or wherever you may be around the world or elsewhere in the US, connecting with me now, and I'm connecting with you guys. And it's in a similar way that we're doing it through social media and can engage in dialogue and engage in fruitful discussions around a certain topic. Similarly, it's instant and asynchronous. So whenever we send out a text or a tweet on Twitter, we send out a post on Facebook, there's always going to be somebody elsewhere in the world that is going to see it. And regardless of when people see it, they can still follow up after. So it doesn't mean that the text in itself disappears. Specifically for healthcare, so for medicine, for public health, etc., what is the role for social media there? We see that there's a lot of use to it, going all the way from conferences where people talk about what's going on at conferences, people follow conferences that they cannot attend, people connect with other people who are attending conferences, with journal clubs, especially the InciSioN Journal Club is a great example that was actually yesterday highlighted by the British Journal of Surgery. Is that you can, from wherever you are and with whoever around the world, you can engage in discussions about certain papers. You can even reach out to authors or get authors included in the discussion and really trim down on what the essentials are of an article and the methodology, etc., behind it, rather than all having to be in the same institution or the same room to do it in person. Similarly, also what I assume you've seen a lot with InciSioN as well is the coordination of research collaboratives internationally as well, by sending out surveys, making sure that people are aware of being able to participate in a certain research project, whether it is descriptive or data collection study, etc. Scholarly dissemination, so dissemination of articles, of blogs, of pieces that you've written that you can share with your followers and wider. Medical education, there are a lot of free and open access medical education tools and platforms online that we can share on Twitter, but also things like tweetorials where people write a thread about a certain topic or some sort of micro blog on a certain topic that especially experts in certain fields sometimes use in trying to educate their followers. And then medical political campaigns, which obviously also play a role on Twitter and which also have been used widely for the better or for good. As a whole, the role of social media in medicine, and especially with global surgery for us as well, is that it's really dedicated towards advocacy, to really spreading awareness about the matter, focus on networking, and focus on priming people for something that they're not aware of, and really trying to make sure that these people are reading about something that they're not aware of and keeping their eyes open for topics related to that and more information related to that. So I'm going to start with Facebook and Instagram and then go on to Twitter, which is going to be the majority of this presentation, simply because of the role of Twitter in global surgery and the presence of the global surgery community on Twitter, as well as simply because of the power of Twitter as a platform. Facebook, giving here the example of InciSioN, InciSion's account, I'm assuming you are following it, but if not, it's at InciSion Student Network. InciSioN is widely prevalent on Facebook, both as a page as well as the Facebook group that we have, where we try to encourage everybody to share whichever topic related to global surgery that they might have with the wider network. But there are some things that you should keep into account when using Facebook, whether your own personal account for more global surgery engagement, or whether you're using the InciSioN account, your national working group account, or so. And that is that you really have to know your audience. So who is following you wherever in the world they are, whichever language they speak, whichever age group they are, whichever stage of the career they are. So for example, for us, our followers on Facebook are mostly students. And so we are going to try and focus a bit more on the general basics as opposed to really rigorous methodology or really complex policy papers, etc. And also most of our posts, although we try to work on it as well, most of our posts are in English, but we do have quite some presence in Sub-Saharan Africa, in the Francophone countries, in Latin America, and Spanish-speaking countries, etc. And this way you can tailor your messages according to those audiences. And having an understanding of where in the world they are can also allow you to tailor it according to which time zone you want to post in. Second, as I mentioned, is switch languages, which is very important and obviously keeps people included and prevents it to become an Anglophone-centric society or platform or messaging or whatsoever. Link. If you have, for example, a blog post that you've written and you want to share, or you think there's an interesting research paper, it's very easy to disseminate. And similarly, people are very attracted, especially on Facebook, to videos and visuals, which when they scroll through their feed easily look at, and that's definitely a powerful tool to include. Then Instagram, so InciSion's Instagram handle is @StudentSearchNet, and Instagram obviously is a very powerful tool for visuals, whether videos or infographics. And therefore it's very important to catch the eye. And some of you have been involved in creating infographics and have done great work with the different campaigns, the different awareness days, such as Global Surgery Day recently. And that's where Instagram specifically is really powerful for, because that's what it matters, really the picture in itself. The strength of Instagram really lies in consistency, in reliably and consistently posting pictures, posting stories, etc., to keep the followers engaged. Use your story literally, both sharing your story as an organization, as members, etc., but also sharing it within the story feature of Instagram, if maybe that's not completely relevant for InciSion, but for whichever organization or individual that you are using your account for, really trying to share what in person is going on. So for example, for InciSion, that could be at the InciSion conference or at a meeting like, for example, the WHA or another conference where the delegation is sent to. But for you individually or for an academic institution, it could be, for example, for in-field work, during interesting class, things like that, to really try and keep the followers engaged. Shamelessly plug, again, don't feel bad about linking things, thinking about, for example, a blog that you wrote, a paper, etc., or a video that you've seen somewhere. And then obviously engage with your audience. If people reply to your story or reply to your picture, try to reply to it as well. Try to see if there's any discussion going on, or if you can further stimulate those people to get involved with InciSion, with global surgery or whatsoever. Now, then Twitter is going to be, again, the majority of this talk, simply because of the power of the platform. Twitter is a more professional oriented platform, in the sense that the entire, well, not the entire, but the majority of the global surgery community is present there, as well as the big policymakers, big academic institutions, big NGOs are widely present and active on Twitter, as opposed to a bit less on social media platforms like Facebook and Instagram, which are a bit more personal. And so this is a good way. For me, I consider Twitter the holy grail of social media, especially for global surgery. And it's a good way to spread awareness about the matter, to get into discussions with bigger people, to make them aware about what global surgery is and what should be done about it, and really allows you to network as a person as well with people from around the world. So for those who already have a Twitter account, it's going to be a bit less relevant, but for those who still have to get a Twitter account, and I definitely recommend you to do so, it's very easy. You simply go to twitter.com and you click on sign up. You pick an easy to remember handle. Your handle is basically your username, similar to the one that you see at the bottom for myself and for InciSioN. It's always good to pick an easy one to remember because people can more easily tag you if they remember what your handle is. But also for yourself, it's much easier to use. And you can put it on your business cards as well. It's a good way to further network as well. A good way to pick a handle could be, for example, just using your first name, last name, or in my case, for example, first initial, my last name, my birth year, something that's very easy to remember, and just to make sure that everybody can more easily find and tag you after. Secondly, you're going to add a picture. It's always better if you smile. People are always more inclined to interact with people, especially accounts that have pictures of people smiling, because it seems more approachable. And add a short bio to showcase who you are, which affiliation do you have, where in the world do you live, what are your interests, etc. And then you can get ready to start. Once you set up a Twitter account, you can send out your my first tweet, which people typically use to send out their first tweet. Very few tweets have been sent out about global surgery as my first tweet. So hopefully, for those who do not have a Twitter account yet and who are following this webinar or watching this video after, they can increase the tally. But it's a good way for people to let people know, look, I'm on Twitter. This is who I am, this is what my interest is, and to encourage people to follow you, and for you to get a sense as well of who's joining Twitter, etc. Then to dissect a bit what a tweet is. So a tweet in itself is a message that you send out on Twitter, and it has different components. It has your message itself, which used to be a maximum of 140 characters, but has now increased to 280 characters. So you can write quite a comprehensive message, but you always want to try and be concise because people are typically reading a lot of tweets, and if your message is just too full of text and just seems not interesting, people might just pass on the text. So try to be concise but comprehensive. And it's always good to tag other people, maybe somebody who you're talking about. So in my case, I was talking about a Facebook post that Melinda Gates posted on Facebook. So I tagged her and the Gates Foundation, and I put in a hashtag for it so that people who click on the hashtag, they can see relevant posts to the hashtag. But also when you see the post, you see it kind of bolded, or you see it in a different color, so it catches your eyes as well when you see the hashtag or that post. Try to leave some food for thought and try to allure people in either interacting with your post or to think about it. So in my case, Melinda Gates' post was about a book that she read about a father with children, with a child with congenital heart defect. And so I shared it on Twitter and I said, look, around the world, over 90% of the so many babies born with congenital heart defects don't get the care they need. Every year, hundreds of thousands of children die because of it. Gates Foundation is doing tremendous work in terms of infectious disease, but also in terms of maternal and child health. So what could be the role for the Gates Foundation in trying to help address it? So this way, maybe she saw it, maybe she didn't, maybe the Gates Foundation saw it, maybe they didn't. But if they did, hopefully this leaves some food for thought. And maybe you also get to interact with other people who see your post and agree or maybe disagree for future discussions. Visuals, again, this is a screenshot that I took from the Facebook page of Melinda Gates to share the post itself. But visuals in itself always allure people to read your post because they might see a visual or an infographic or a picture that they're interested in or want to find out more about, or they see it and then they see your attached post to it. Typically posts or tweets that you send out with a picture have a 94% higher engagement rate, so more chance of being seen by people and interacted with than posts with just text in itself. So always, where relevant, where appropriate, and where possible, try to attach a visual as well. And then tag. In addition to your text itself, you can also tag people in the picture, up to 10 people. So if you think there's somebody relevant or an organization that is relevant, you can tag them in the picture so they can see that you wrote this post and so that other people also can see who is relevant to this post and to this field, and they can follow those as well. A useful tool, and this is a bit more of an advanced technique, or maybe an advanced fact, is that if you post a tweet yourself, so this is only if you post it yourself, next to the likes you can see these graphs, and if you click on it, you can get a sense of how good the post is doing. So how many people have seen it, which is impressions, and how many people have engaged with it. And that could be because they clicked on it, they clicked on the picture, because they clicked like, because they clicked on your profile, because they clicked retweet, because they replied, etc. So it's a good way for you to see, okay, what is working for me, which pictures, which timing, which topic, etc. If you really want to tailor your messages further. And so as a whole, that the role of that and the role of Twitter and the role of your tweets is really to engage with people and to impress, in the sense of not to impress people as we know, but impress in the sense that you want people to see your texts and your tweets. You really want to bump up those impressions if you want your post to be seen by a lot of people. This is going to be probably common knowledge for most people, but just to reiterate here, how not to tweet. So don't try to use too many hashtags. Hashtags are popular on Twitter, but it's a bit annoying to read if your entire post is full of hashtags, because it's harder to read. It's not very easy on the eye, etc. So try to use 2 to 4 per tweet. It's fine if you have more. It's obviously fine if you have less, but definitely don't make 4 sentences full of hashtags. And be grammatically conscious. Don't type everything in caps. Don't use exclamation marks after everything. Try to make sure that you're conscious about commas, about making your sentences separately, etc. And then a tip how to tweet during the year. Try to stay up to date. The power of Twitter is helping you stay up to date. You can really see about which papers are being published, which events are going on, where is whoever going to, what is going on in the news. For example, I follow my news by using Twitter, but also in terms of global surgery, journals, InciSioN, Harvard PGSSC, etc. always typically post the recent journals or the recent articles, sorry. Events that are coming up, such as Twitter chats, journal clubs, global surgery conferences, abstract submission deadlines, scholarship opportunities, etc. So there's really a lot going on global surgery on social media, particularly on Twitter. And so it's a good way for you to stay up to date with whatever is happening, but also for you to share something new. So for you to stay up to date generally, but also on Twitter, and for you to share with your following something new. So for example, this post of mine was right ahead of the WHA, the World Health Assembly, this year in Geneva again, in May, so a couple of months ago. So back in 2015, the WHO resolution got passed on the role of surgery and anesthesia within universal health coverage, acknowledged by the WHO and all member states. And every 2 years, it is mandated that there should be an update by the WHO and by the member states. Well, it's not mandated, but encouraged for an update by the WHO and the member states on the resolution. And so this year, in this big report by the Director General, which is Dr. Tedros from the WHO, there was an update on several resolutions, including the one on surgery, anesthesia, and obstetric care. It was 1.5 pages that he wrote about it to give an update on it and give a bit of a more view about the importance thereof. And so I shared it. I said, okay, look, people, like, this is out. This is important to know. It's great fact for the global surgery world. But just to make sure that I say it here, I was not the first one. It's just that I'm sharing it with people who might not have seen it, because I might have different followers than people who had already shared it. So there's no problem in sharing something else, especially not if you're giving a personal touch to it. So you're letting your followers know what's going on. Try to provide new content, especially if you add a personal story or opinion. So again, it's fine if somebody else posted it already, because you're going to have different followers. You're going to have a different caption. You're going to have a different touch to it, ideally. In my case, it was that I followed up with a long thread. Try to partake in Twitter chats, further engage with others, and tweet at high-level accounts. Twitter chats really give you a chance to interact with people and to discuss with people who you normally might not discuss with, or get into discussions about certain topics. And tweet at high-level accounts, just like you saw earlier with the Melinda Gates and Gates Foundation post, as well as here with Dr. Tedros and WHO. They might not reply. They typically don't reply, which is totally fine. But it's also, again, a matter of priming, because they see how many people are tagging them. They see what are they being tagged about, even if it's social media, individuals that or personal relations committees that are taking care of the organizations or individuals' accounts. It is still a matter of priming for them to become more and more aware of what is going on and why they're being tagged about a certain specific topic. And try to share some insights from the field. So if you're working somewhere, always make sure to ask permission locally. You don't want to post about something that you don't have permission to post about, especially if it's something medical related. But if you say, okay, I'm at a conference, you can consider that as a field as well. Try to share some insights about where you are, which conference, what's going on. Again, personal touch, something that other people might not be seeing through the same lens, something that other people might not be experiencing, and that is interesting for others to know about as well. This is then how to tweet at events. So if you're going to a conference, highlighted a tweet by the Harvard PGSSC here. I always recommend to tweet ad verbum. Ad verbum means that you really use the words that have been used, because that way you can quote people, and you can also tag them and really showcase how they, for example, in this case, vocally commit to something or how they think about a certain topic. I am going to caution, though, is that if you're going to tweet ad verbum, make sure that you've properly heard what he or she has said, because you wouldn't want to tweet something that you misunderstood or misheard or only heard a part of, because it could be that you're tweeting something that they have not said. So always make sure that you heard it properly, and if you didn't hear it properly, that's fine, and just share something general about the event or whatever. Again, take a picture. It's always helpful. One, you showcase who's in the room, what's going on, you're there, but also it increases the visibility of your post. People are more inclined to see your post, more inclined to read and engage with whatever you've shared. Third is tag the speaker, whoever said it or whoever is speaking, and whichever affiliation that they might have. And other relevant accounts. So maybe somebody who is at a conference that you also want to tag because he or she has quite a strong social media presence, or you feel that, for example, there is somebody that you know that would be interested in this and you want to make sure that he or she is aware of it, etc. And then lastly, include the conference hashtag. If there is a conference going on and there is a hashtag, that's a good way for people to see every post about that conference, so they don't have to look in the wide world of Twitter, but they can easily find it by clicking the hashtag. But also it allows you to connect with other people who are at the conference. I've had a lot of conferences where I've met up with people who I've never known before, or who had known before but never met in person, simply because I saw that he or she were at the conference as well by tagging that specific conference. And so it's a great opportunity, not just to spread awareness about things, but also for you personally to network as well. Some tips seem straightforward, but just so you know, be prepared, especially if you're going to tweet a lot. Your battery is going to drain. I can't stress that enough. Connectivity is important as well. Obviously, like, make sure that you have good connectivity in terms of Wi-Fi or mobile data. Make sure you know the handles and the hashtags of the people who are at the conference who are speaking. And maybe less relevant for you individually, but if you're working with your national working group or with another organization and you're going to a conference, it's always helpful to create a social media guide where you can share standard tweets about access to surgical care, for example, general tweets about a speaker that is coming and that has previously written about or spoken about or done something about global surgery that you can then further link as well for people at the conference to be aware of and things like that. Then coming closer to the end, some general Twitter tips and tricks for you to be aware or take into account, which might help you to make your messaging more efficient and more effective. There's nothing wrong with provoking on Twitter. You can provoke, but make sure you provoke wisely. Obviously, don't offend people, don't be aggressive, be conscious about what you post. But again, it's not bad to provoke if it's done in a proper way. So this is an example of the WHA last year. It's in 2018, where on the basically T-1, so the day before WHA starts, there's always a big introduction session for people who are new to the WHA to become aware of what is the WHA, what is going on, what is going to happen that week, what is policy, what is the WHA, how is the WHO structured, things like that. And it's always very well attended. Now, we all know that 5 billion people in the world do not have access to safe surgical, obstetric, and anesthesia care, but not everybody knows. And at the WHA, it's not always, this year was different, but it's not always a point of discussion. And so I put out a provoking tweet saying that, okay, look, there's so many people here. Around the world, 5 out of 7 people do not have access to safe surgical and anesthesia care, yet we don't talk about it here. Would it be different if in Geneva or in this audience, 5 out of 7 people don't have access to surgical care? Will we talk about it then? And so it's a bit of a provoking tweet, but it's not in a sense that it is offending people. It's just to make sure that people are aware of what is going on and what is not being discussed. So that is one point. Second point is, if you want to share articles, try to summarize it. Try to share an important sentence that you read in the article that you wanted to share. Try to summarize it yourself so that people who read the summary are interested in it. They might know already everything about the topic then because you summarize it so well, or they might be very interested in reading the entire article because if you share just a link or if you just share the title, it might still be interesting. People might still be interested, but people feel less of the incentive to go and look because they see so many articles, they see so many papers passing by. So that's that. Then some other tips and some useful tools on Twitter is that Twitter has the opportunity for you to create lists. You can make those lists for yourself or for public. And a list is basically where you say, okay, look, there's so many accounts that are relevant to whatever I'm interested in. That might be about football, it might be about global surgery, it might be about anesthesia care in general, it might be about HIV/AIDS, whatever that is. And so you say, okay, I really want to follow them and I want to make sure that I have all these posts together, whereas accounts that are not relevant to that would otherwise be interspersed with it, and it would be very messy for me to follow what is going on if I would just follow my feed. And so you can create a list. In my case, I created a global surgery list where I included some bigger organizations or organizations that are doing relevant work to global surgery, and I can put them all in there just to make sure that if I go through that feed, I only see accounts relevant to that. Not everybody uses it. I have to say that I don't use it all the time, but it is very helpful because it allows you to declutter your messages and really try to categorize the accounts that you're following just to make sure that, okay, I'm interested in global surgery and I want to read about this, or I'm interested in cardiac surgery and I want to know what's going on about this recently. So it's a bit of a way for you to organize your Twitter feed. And then to the right, Twitter chats. I've addressed this a bit prior, but with InciSioN and with a lot of organizations, Twitter chats are held around the world and around the year, almost all the time about specific topics. Typically, Twitter chats are about an hour, and it's a way where organizations or individuals share questions, and people who are participating in the Twitter chat answer those questions, get in discussions, and really do so under a combined umbrella of the specific Twitter chat hashtag. So an example of this picture here is the Breaking Down Silos Twitter chat that we had on Global Surgery Day. at the WHA again this year. And it was a very well attended Twitter chat where people can click on the hashtag and they see, okay, look, everybody who's posting around this hashtag is relevant to the Twitter chat, and questions were being asked by InciSioN, and people replied to their input, or gave their input and replied to the questions with their ideas about how to break down silos in global surgery and how to move forward. And it's always a very nice way for you to share your thoughts, but also to learn more about what other people are thinking about a certain matter. And again, especially if you're newer to Twitter and newer to Twitter chats, it's a great way to network as well, because every single time you participate in a Twitter chat, there's going to be at least some person, some account that you've not heard of before, or who has not heard of you before. And so it's always a good way to build your network and to hear other people's thoughts. And then lastly, coming to the end, some general tips and tricks. So to the left are some tools that I'm not going to dive into too deeply, simply because you can work on those for hours if you wanted to. But TweetDeck is a very useful tool that is free by Twitter for you to schedule posts, to have everything more organized, so you can see different Twitter lists next to each other if you want to have it on one screen and don't really want to jump from one to the other. It allows you to schedule things. If you say, okay, I want to post a lot this week, but I don't have time, I have an hour now, so I can schedule some tweets, especially if you're an organization. That's very helpful. Hootsuite is a similar thing. It's not free, but it allows you to also link Facebook accounts, Instagram accounts, other accounts to that as well, so you can use all of them at the same time. And then lastly, Twitter Analytics is a tool that's also free by Twitter and allows you to understand who's following you, where they're living, what is their background, when are my tweets reaching the most people, what topics are reaching the most people, etc. And then just to close, some general thoughts to the right is, again, tweet responsibly, don't be aggressive, don't offend people. Try to make sure that your posts are neutral. It's fine to tweet, but try to make sure that they are neutral in itself. And assume that everything you tweet is permanent. So if you say, okay, oops, I tweeted something wrong, I'm going to delete, which is fine, especially if you do it within 1, 2, 3 seconds. But still assume that everything you tweet is permanent. So make sure that you always take a few seconds to double check your tweet before you send. Because even if you delete it after a second, there is a chance, especially given how many people are on Twitter, that somebody saw it, somebody took a screenshot out of it. So make sure that you're not talking about something offensive, etc., before you send it. Try to engage more than you distribute. It's great to tweet a lot. People appreciate that. But it's always fun for people if you engage with them as well. If you retweet people's tweets, if you reply to it, if you like it, etc. Because it's not, Twitter is not a one-way street. You don't know everything. Nobody else knows everything. There's always a post that you like, etc. So it's always good to acknowledge that as well from other people, and maybe share some opinion that you might have on a certain topic with them when reading so. And don't just regurgitate. Again, share your thoughts, share your opinion. Everybody has a different opinion. Everybody might have a different background knowledge on a certain topic or a different field that they're coming from, and watching or approaching a field very differently. People are working in the global surgery field from an academic perspective are very different than people who are working in the field, and very different from people who have a more anthropological, social sciences background. So really make sure, not per se, but really try to share your thoughts and showcase how you're thinking differently than people typically think. If you want general tips about how to get a bit more advanced tweeting in global surgery, I wrote an ebook on it, which is on InciSioN, and that you can freely access. It's freely available on InciSioN, and it's a general summary of this presentation, but also some more advanced tips and tricks on how to advance your Twitter presence. And with that, I'm going to come to a close, and I'm going to leave some time for people to ask some questions if they might have any. Thank you.
Thank you very much, Dominic. Very helpful tips you shared with us.
Thank you. If there's no questions, that's totally fine. I'll stick around for 2, 3 more minutes, just to make sure that I'm not interrupting anybody who might be typing, or who is still a bit hesitant to ask a question. Feel free to always reach out to me afterwards. Feel free to post a question in the InciSioN groups, or mail me after, or mail whoever after. I'm always happy to answer that. I hope this is helpful. I hope for the people who are not on Twitter yet that they are a bit stimulated to get started with Twitter. And for those who are on Twitter but have been a bit hesitant of being a bit more active on Twitter, or any other social media platform for that matter, hopefully are encouraged to do so, and are encouraged to do so in a more efficient manner as well.
So, thank you again, Dominic. I have a question. It's more or less related to like keeping up with social media accounts and things like that. You know, I mean, it's a busy schedule. How do you really keep up with like every topic, every trending thing happening in the global study community, like every conference? So for me, that's one of the biggest problem I face in handling with the various, because I manage our national working group accounts and my personal account. So sometimes I lose track of a lot of things. So what suggestion would you give in that regard?
Yeah, and that's a very great question, a very important question as well. So the downside of Twitter and Facebook and Instagram, for all that matters, and I'm sure that many of you are aware, if not all of you are aware, is that you can go down the rabbit hole. Like, you can continue to scroll, you continue to watch accounts for an indefinite amount of time, basically. So it's really up to you to make sure that you are aware of what you want to see, which topics, how much time you want to spend on it, what is really your priority. And that's why for Twitter, for example, it's very helpful to have those lists. If you say, okay, look, I want to follow so many different topics, and I really want to, I'm interested in all of these, then it's helpful for you to make lists so you can categorize what you're interested in. But if you say, look, I'm using Twitter only for for my example, for example, for my situation, I'm only using Twitter for 1, global surgery matters, and 2, cardiac surgery matters. So accounts that I'm following are all related to that. I'm interested in news, I'm interested in football, I'm interested in more general aspects as well, but I'm consciously not following those on Twitter, simply because otherwise my feed would be completely swamped. Otherwise, I would be continuously scrolling, continuously clicking on links here and there. And I have other platforms that I'm using online to get more information about news, because I read the New York Times, because I want to read a sports-specific platform for football news, etc. I'm not using Twitter for that consciously. If you're using multiple accounts, then the good thing about the new Twitter platform on your desktop, but also already on your phone, is that you can easily switch between accounts on your phone. So that's already helpful. But similar to having different topics that you're interested in, it always allows you also to go down the rabbit hole. So again, make sure you're conscious about what is my priority, and if I'm going to use multiple accounts, what am I using the different accounts for? If I'm using my own account, what are the topics that I want to engage with? What are the messages that I want to send out? What are the messages that I want to share with my followers? If I'm using the account of my national working group, what are the messages that I want to share with that one? Is it because personally I want to share about a class that I've had, or personally I want to share about a blog that I wrote, or a video that I saw? That's fine. But then for your national working group, it might be, okay, our national working group had this activity or has this coming up, etc. So it's going to be very different. So make sure you know for every account that you're using, what do I want to share? What do I want to post? So you don't lose too much time. And then in terms of time management, even when you're traveling, when you're busy. Twitter is a very convenient tool in the sense that the app is very straightforward, um, is very efficient in my opinion to use. You barely lose any time. You can do that when you're standing in line. You can do that when you're on the train. You can do that whenever you're boarding on a plane. You can sometimes do it offline if you've already downloaded a lot of tweets. So it doesn't take so much time for you to quickly scroll through a feed. If you say, okay, look, I'm interested in global surgery. I have a global surgery list. I want to know what has recently been done by specific organizations, which articles have been published. And so you can easily, in just 10 seconds, 15 seconds, scroll through your feed and see, okay, look, this article has been published. InciSioN hosted this event. Aswan has been to this conference and has written this paper. So you can really quickly see, okay, look, this has happened in the global surgery world. I've barely lost any seconds. I barely lost any minutes. I'm still on my way to do whatever I wanted to do. So really try to tailor your interests and your time to whatever you really want to prioritize.
All right. Thank you very much.
Thank you.